So as the candidates were sparring over the feasibility of Medicare for All in the last debate, you might have noticed Klobuchar and Buttigieg kept throwing this number out, $30 trillion. We can't afford a $30 trillion hole in our deficit, is what Klobuchar said. So if you're not familiar, there was a study done by Mercatus that projected that over 10 years, Medicare for All would cost $32.6 trillion. And in fact, the day after the debate, a new study was released by the Urban Institute, which gave an even higher projection of $34 trillion. With regards to the Mercatus study, it was repeated over and over. It was celebrated by progressives how the study noted, and it was funded by the Koch brothers, which they're highly conservative, but that this study revealed that national expenditures would be $2 trillion cheaper, which is great. But at the same time, Buttigieg and Klobuchar, they have a good point in noting that we have to have a more detailed plan with regards to how to pay for Medicare for All. Now, that's not to say that I agree with Buttigieg and Klobuchar, because they're coming at this fatalistically as if it cannot be done, and I argue, yes, that it can be done. But so the New York Times, they noted the varying amounts projected by different studies, giving an annual amount and the estimated cost over 10 years. Gerald Friedman's study was sort of on the low end, estimating about $2.6 trillion. And that's that's in addition to the $1.42 trillion that we already spend on Medicare and Medicaid. And the Urban Institute was on the high end of $3.87 trillion. So that's a significant amount of difference. It's about $1 trillion difference between these two studies. So there's a lot of variables that result in this huge disparity. In fact, there's some things that are a little iffy about the Urban Institute study, which I'll get to later. And let me just put a chart up as well that shows sort of a visual of the studies. So the New York Times article that I sort of plucked these numbers from states that the big differences in the estimates of experts reflect the challenge of forecasting a change of this magnitude. It would be the largest domestic policy change in a generation. The proposals themselves are vague on crucial points. More broadly, any Medicare for All system would be influenced by the decisions and actions by parties concerned, patients, healthcare providers, and political actors, in complex, hard-to-predict ways. But seeing the range of responses and the things that all the experts agree on can give us some ideas about what Medicare for All could mean for the country's budget and economy. And the article continues elsewhere. The biggest difference between the Mercatus estimate and the Urban one is related to how much the new system would pay doctors, hospitals, and other medical providers for health services. Mr. Friedman's estimate, the least expensive of the group, assumed that the government could achieve the largest cost savings on both prescription drugs and administrative savings. In fact, that was one of the criticisms that the People's Policy Project had of the Urban Institute study, was overestimating administrative costs. For example, 25% of hospital revenue, as things are today, goes to the provider. However, in countries where Medicare for All actually works, that number is down to 12%. Now, the Urban Institute used the 25% figure. Additionally, the People's Policy Project criticized the Urban Institute study for its kind of funky, unclear way of coming up with their utilization elasticities, which is just a fancy word for the fact that there's more, that healthcare is more available. People will now proceed to use it more. Now, it's really hard to come up with such a vague variable, right? But this is from the study. The study states, we do not assume limits on utilization of care because of supply constraints, because our estimates assume a long-run equilibrium. That is, provider capacity expands to meet the increased demand for services that result from universal coverage, benefit expansion, and the elimination of cost-sharing requirements. So, to reiterate, provider capacity expands to meet the increased demand for services that result from universal coverage. In other words, yes, obviously, there will be an increase in demand, therefore there'll be more doctors, more hospitals, but the study needs to indicate some mechanism by which they formulate a projected expansion, right? Because that's a pretty key variable in projecting the ultimate cost of Medicare for All. And in that, the People's Policy Project say that they lack clarity, that this study lacks clarity. There was a nice Jacobin article. They state that since the federal government takes on nearly all health spending under Medicare for All, federal health expenditures will necessarily go up a lot. $32.6 trillion over the next 10-year period, according to Blouse. But this is more of an accounting thing than anything else. Rather than paying premiums, deductibles, and co-pays for healthcare, people will instead pay a tax that is, on average, a bit less than they currently pay into the healthcare system, and for those on lower incomes, a lot less. As advocates of Medicare for All have been saying, costs will go down and there will be some amount of tax increase. But overall, it's a net savings. Unfortunately, during the debate, Elizabeth Warren failed to make the point that, yeah, there will be a little bit of a tax raise on you. If you're in the middle income, yeah, a little bit more in taxes, but a net savings in cost. She only says half of that equation, and it gives credibility, or at least the appearance of credibility, to Klobuchar and Buttigieg and others making similar arguments that Medicare for All isn't feasible. It gives them credibility, like they're living in reality, right? They're not putting forward plans that are totally unaffordable. They're putting forward plans that'll work, the public option. And so that's why Elizabeth Warren needs to be straightforward. And that's why I believe Bernie Sanders is the person to make the case for Medicare for All, aside from the fact that he is the one that, quote unquote, wrote the damn bill. But regarding the public option, I feel like there's not enough, Biden and Klobuchar and people putting forward the public option are not put in a position to have to defend it to the extent that people that are proposing Medicare for All are put in a position to defend their plan. Now, this may make sense on some level because Medicare for All is more expensive, but when you think about it, Buttigieg says his plan is supposed to be a glide-in into ultimately to Medicare for All, and Buttigieg has said in the past that he supports Medicare for All. But let me just read you something. So this is an article written in The Nation by David Himmelstein, who is a professor of public health. The case for a public option results on faulty economic logic and naive assumptions about how private insurance actually works. Private insurers have proved endlessly creative at gaming the system to avoid fair competition, and they have used their immense lobbying clout to undermine regulators' efforts to rein in their abuses. That's enabled them to siphon hundreds of billions of dollars out of the healthcare system each year for their own profits and overhead costs, while forcing doctors and hospitals to waste billions more on a billing-related paperwork, which I should also note that the Buttigieg healthcare plan is estimated to be $1.2 trillion over the next decade, which is substantially less than the $30 trillion that keeps coming out with regards to Bernie Sanders' proposal. So both Biden and Buttigieg support this sort of buy-in approach to the public option. And the article continues stating that no working models of the buy-in or pay-or-play public option variants currently exist in the United States or elsewhere, but decades of experience with Medicare Advantage offer lessons about that program and how private insurers capture profits for themselves and push losses onto their public rival. Strategies that allow them to win the compensation while driving up everyone's costs. And the article continues elsewhere. This year alone, private insurers will take in $252 billion more than they pay out, equivalent to 12% of their premiums. A single-payer system with overhead costs comparable to Medicare's 2% could save about $220 billion of that money. A public option would save far less, possibly zero, if much of the new public coverage is channeled through Medicare Advantage plans whose overhead is at 13.7% is even higher than the average commercial insurer. And the article continues stating a final point. While allowing private insurers to compete with a public plan amounts to a poison pill, the same isn't true for supplemental private plans. that are allowed to cover only those items excluded from the public benefit package. While Canada bans the sale of private coverage that duplicates the public plan's benefits, it has always allowed supplemental coverage, and that hasn't sabotaged its system. The efficiency of a single-payer system would make universal coverage affordable and give everyone in the United States their free choice of doctors and hospitals. But that goal will remain out of reach if private insurers are allowed to continue gaming the system. Preserving the choice of insurer for some would perpetuate the affordability crisis that has bedeviled the U.S. healthcare system for generations. Proponents of the public option portray it as a non-disruptive, free choice version of single payer. That may be good campaign rhetoric, but it's terrible policy. And this is from the American Prospect. Biden and Buttigieg have separately proposed public options that would compete with private insurance. In Biden's plan, even those with employer-sponsored insurance could opt out and choose the public plan. Buttigieg would offer subsidies to help people pay for the public option, capping the cost of insurance at 8.5% of income. Both explicitly pitch this as a cheaper way to establish universal coverage, but that claim relies on a hide-the-ball scenario. Biden or Buttigieg's public option over time will either serve as a weak alternative to private coverage with high premiums and substandard coverage, or backed by government bargaining power, it will outshine private insurance and gradually supplant it. Buttigieg himself talks about his plan as a glide path to Medicare-for-All. If it doesn't work, the public option will certainly be cheap, but it also won't help anybody at a meaningful scale. If it does attract millions of customers, then in the long run, it would approach a single-payer system. At that point, on the how will you pay for that question that Biden and Buttigieg are posing, it faces the same challenges as the Warren-Sanders model. Biden and Buttigieg take advantage of the fact that we use a bizarre and often faulty system to score legislation in the Congressional Budget Office, which only looks at a 10-year window for budgetary impact. If the public option is good and it eventually becomes a kind of Medicare for all, the cost spike would all happen outside the 10-year window. So Biden and Buttigieg are either lying about how effective their public options will be, or they're lying about how much they will ultimately cost. They can't have it both ways. So Buttigieg and Biden, they get off the hook with regards to this how you're going to pay for it question. And you could argue, okay, well, that's because the progressives, they're putting forward all these, monetarily substantial plans like the Green New Deal and the health and Medicare for all. So it makes sense to focus the attention on how are you going to pay for their policies? How are we going to pay for it? Well, here's the thing. The political establishment, are putting forward expensive ideas, or rather the status quo is already in a continuity of putting forward expensive ideas like regime change wars, fat military budgets, low marginal tax rates on the wealthy, and the fact that a wealth tax is something that every candidate has not hopped on. Is that not some sort of just tacit endorsement of the wealth inequality in this country? Or that if you're not for a wealth tax, why aren't you for something else that would fulfill the same requirement of producing revenue for this country to put into social programs? And by the way, when it comes to this question of how are you going to pay for it, Bernie Sanders did list a number of things in 2017 when putting Medicare-for-All into Congress. He stated that these are the following options: 70.7, and he sort of floated them out there, 7.5% income-based premium paid by employers, 4% income-based premium paid by households, savings from health tax expenditures, make the personal income tax more progressive, make the estate tax more progressive, and on and on and on. You can keep reading it, but the total comes to about $16 trillion in new revenue. Which, by the way, it lists the wealth tax on here, and it states the idea of establishing a wealth tax on the top 0.1%, which would produce $1.3 trillion over 10 years. His wealth tax that he came out with recently, I believe it was September, comes to $4.35 trillion over the next 10 years. So individuals have raised legitimate concern about the wealth in the face of a high tax trying to evade taxation, right? It's called capital flight, trying to prevent those large taxes. And Vox reports the idea behind a tax like this is that it would significantly reduce the accumulation of extreme wealth. That is referring to the wealth tax that Bernie Sanders has proposed. For one, the tax itself would incentivize wealthy people to, well, be less wealthy in the eyes of the government. As Iglesias explained, the mere existence of the wealth tax would, on the margin, encourage wealthy individuals to dissipate their fortunes on charitable giving and lavish consumption. If you try to hoard wealth, the government is going to tax it, so you might as well spend it. That is both a feature and a bug, but as some experts have pointed out, it might also encourage rich people to hide their wealth. As Saiz and Zuckman have written in the past, these kinds of tax proposals are fragile. They can be undermined by tax limits, base erosion, and weak enforcements, The Economist wrote in an early September 2019 paper. That's why many countries have abandoned them. As Iglesias pointed out, of the 12 OECD members nations that had wealth taxes in 1990, only 4, France, Norway, Spain, and Switzerland, continue to implement them, but Zuckman and Saiz argue that tolerating tax competition and tax evasion is a policy choice. Sanders does address enforcement in his plan. He is calling for a national wealth registry and significant additional third-party reporting requirements, as well as increasing Internal Revenue Service funding to enforce the wealth tax. The plan calls for a mandated IRS audit of 30% of wealth tax returns for those in the 1% bracket and a 100% audit for all the billionaires. It also establishes a 40% exit tax on the net value of all assets under $1 billion and 60% over $1 billion for anyone that wants to take their wealth to another country. So you can see there is a strategy of enforcement regarding the wealth tax. And I realize billionaires are savvy, and so are their accountants, and they're going to do whatever it takes to avoid those billionaires having to pay that tax money. But we will have to adapt as they adapt, and then they will further adapt, and so on, in sort of an arms race of trying to outsmart each other, of us trying to get that tax money, and them trying to avoid paying that tax money. And things have always sort of been that way, more or less to some extent. But and I understand it will be even more frustrating considering we're trying to collect even more revenue. But it is necessary. It is not acceptable to just throw a white flag up and accept the fact that wealth inequality is so bad in this country and so many people are meanwhile dying by being uninsured or underinsured, which I realize, well, let me just recap some figures, that the wealth tax will be $3.5 trillion, as already stated, and the figure of all of Bernie's proposals regarding raising revenue adds up to about $16 trillion, and altogether, that's nearly $20 trillion. Now, I know that is not sufficient to pay for Medicare-for-All if you are to stand by the estimate of $30 trillion over 10 years, but And I also understand that Medicare-for-All is not the only bold proposal being put forward by Sanders that costs money. There's also free college for everyone, and there is also the Green New Deal. But there are other ways of making money, and I'm sorry, I do believe we need to redistribute more wealth from the richest in this nation to the poorest in this nation to make sure that all individuals are covered, and to make people understand why this is the way to go. Let me just familiarize you guys with how bad wealth inequality is within this country if you're not already familiar. Now, take note of this chart. 1963. Now, by the way, this is according to the Urban Institute, and this is estimates of family wealth. And maybe it is important to note that wealth equals a family's assets, and people making over $500,000 is what equals the 1%. That's why these figures may look considerably low, but it does measure the sort of flow toward the top. of net income going to the top. And also, please note of this chart that the figures are not sensitive to the variations within the 1%. An example being Jeff Bezos being worth $111 billion. It just doesn't show up on this chart because they sort of averaged it all together within the 1%. That's everything between 500,000 and 111 billion, right, within this chart. So 1963, you see a pretty reasonable wealth disparity, right? That's not a big deal, not a big giant leap. And that was not terribly long ago. Now let's jump to the beginning of the Reagan era, and it does jump up some, but by the time we get to the end of the Reagan era, it jumps even more. And by the time 1992 rolls around, no meaningful change, nor in 95. By the time 1998 comes, it jumps a little more, a lot more. A lot more by the time 2001 comes. Now, this is at the end of 6 years of Congress being sort of locked up by Republicans. Republicans were out of power for about 40 years within Congress, and they got back into power. And after that 6 years, after the 95 revolution, you can see that the wealth disparity became quite large. But don't worry, guys, because Obama's going to get elected in 2008 after the Bush era. So, he's going to fix this. He is the hope and change we've been waiting for. But, okay, let's go through the George W. Bush administration, 2007. Damn, it jumped a hell of a lot. And by the time 2010 rolls around, this is after the financial recession. You can sort of see how everybody's been hit hard. Even the ultra wealthy, it's gone down. But, Obama's going to make sure that wealth disparity doesn't get out of control again because he is the hope and change we've been waiting for. Now, 2013 comes and, you see some recovery for the wealthy. That wealth disparity is sort of jumping back. In 2016, holy shit, Obama, what the fuck did you do? This should have been on his mind every day getting out of bed. Holy crap, look at this wealth disparity. Democrats should have been outraged. It should have been highlighted in the 2016 campaign. It should have been all over the place. It shouldn't have taken Bernie Sanders to run for office. This should have been on everybody's mind. The moderators should have asked a zillion questions about the wealth disparity in this country. As you can see, they just didn't. Now, why I like that chart is that it shows the change over time, but there are things I don't like about it. The fact that, as I said from the onset, that it doesn't clarify or it averages the people making over 500,000 and averages them with the billionaires and comes up with that number. And it's about family assets, which makes the number even smaller. But I'm going to show you this portion of a pretty famous video that was circulating a great deal during the Occupy movement. But it's based off 2010 research, right? But it does show the disparity of wealth between the poorer end and the richer end. Just take a look.
9 out of 10 people, 92%, said this was a nice, ideal distribution of America's wealth. But let's move on. This is what people think America's wealth distribution actually looks like. Not as equitable, clearly, but for me, even this still looks pretty great. Yes, the poorest 20 to 30% are starting to suffer quite a lot compared to the ideal, and the middle class is certainly struggling more than they were, while the rich and wealthy are making roughly 100 times that of the poorest Americans and about 10 times that of the still healthy middle class. Sadly, this isn't even close to the reality. Here is the actual distribution of wealth in America. The poorest Americans don't even register. They're down to pocket change, and the middle class is barely distinguishable from the poor. In fact, even the rich between the top 10 and 20 percentile are worse off. Only the top 10% are better off. And how much better off? So much better off that the top 2 to 5% are actually off the chart at this scale. And the top 1%, this guy, well, his stack of money stretches 10 times higher than we can show. Here's his stack of cash, restacked, all by itself. This is the top 1% we've been hearing so much about. So much green in his pockets that I have to give him a whole new column of his own, because he won't fit on my chart. 1% of America has 40% of all the nation's wealth. The bottom 80%, 8 out of every 10 people, or 80 out of these 100, only has 7% between them.
I want you to keep in mind that those numbers that you saw, that's from a 2010 study. Now let's see how things look in 2017. With the Business Reporter or the Business Insider reported the top 0.1% of American households holds the same amount of wealth as the bottom 90%. And the article reads, developed market economies such as those in Germany, France, and Sweden tend to have a higher GDP per capita and lower Gini coefficients. A low Gini coefficient indicates more wealth equality, less inequality. On the flip side, emerging market economies like Russia, Brazil, and South Africa tend to have a lower GDP per capita. That is to say that they're poorer, but a higher Gini coefficient. That means to say they're less equal. Now, the U.S., however, is a big outlier. Its GDP per capita is on par with developed European countries like Switzerland and Norway, but its Gini coefficient is the same tier as Russia's and China's, meaning we have a shit ton of inequality. And here's a graph within that article sort of demonstrating this, and you can see that there's a nice smooth line that indicates this correlation between a low GDP per capita and a high Gini coefficient, and vice versa. Nice smooth line, nice consistency. And there's the United States. We're just this huge outlier, as the article stated. We have all this wealth and yet all this inequality. So when people ask, how are you going to pay for it? How are you going to pay for it? Well, there's a freaking way to pay for it. Look, the wealth is all concentrated. And to think that's some sort of grave injustice, or to have the lack of political courage to try to do something about that and make sure that ambitious programs that will save millions of lives are paid for. If you lack that kind of courage, it really says something about which team you're fighting on. That speaks for you, Buttigieg. It speaks for you, Kamala Harris, and you, Joe Biden, and other establishment corporate candidates. Now, this is from The Atlantic, and this is talking about an idea of how to further pay for Medicare-for-All. And it states that the value-added tax, or the VAT, which would function as a sort of national sales tax on consumption, or is a sort of national sales tax on consumption, while a broad base value-added tax on a wide range of consumer goods might be a burden on the poor and the sick, rebates, subsidies, or exemptions could create a rich revenue source that places the burden on the middle and upper classes and doesn't affect investment or savings. The presence of a government healthcare monopoly and questions of border adjustment for pharmaceuticals and medical devices would complicate the analysis, but consumption taxes and extraneous healthcare services, prescriptions, or in contracting between physicians and vendors could also be used as a control for utilization in government expenditures. Indeed, many countries with comparable high-cost universal coverage systems supplement their funding with broad-based consumption taxes. Even if a value-added tax or other new tax schematics aren't on the table, the policies on the table will have to be tweaked so that they fit the goals of Medicare for All in order to create a system that is both economically progressive and provides for health equity. It will have to abide by three main rules. People under certain incomes should receive more on average in lifetime benefits than what they pay in taxes. The system should itself lower costs, and when supply is finite, it should be directed towards those who need more care. Tax policy and the funding structure matter for each of those. They aren't ancillary concerns. Rather, they affect the nuts and bolts of how the policy works. It's not just about where the money comes from, but from whom it comes from and how. Health and wealth are intricately connected. Health policy is tax policy. So a value-added tax, that's one method of potentially raising some money. And the Urban Institute stated from, and this is written in 2012, and it was co-authored from someone from the Urban Institute and someone from the Brookings Institute, that we propose a value-added tax to contribute to the U.S. fiscal solution. A 5% broad-based value-added tax paired with subsidies to offset the regressive impacts could raise about 1% of GDP, or about $160 billion a year. So, 1% of GDP, presuming that's all still true, 1% of GDP now would be about 214 raised annually, or in 10 years, $2.1 trillion. Now, I know it's a small dent in the money needed for Medicare for All, but it is something. And that's what it's going to take. It's going to take clever new forms of taxation, and it will involve raising the taxes some on the middle class, which is something Elizabeth Warren needs to be straightforward about. So I mentioned how bad wealth inequality is in this nation and the need to utilize some mechanism like the value-added tax to borrow from the top and give more to the bottom to make Medicare for All more affordable. But I want to talk real quick about the United States healthcare system versus countries with Medicare for All. Now, according to the Kaiser Foundation, and this was written in March, the U.S. lags behind similarly wealthy OECD countries, those that are similarly large and wealthy based on GDP and GDP per capita. In some cases, such as the rates of all-cause mortality, premature death, death amenable to healthcare, and disease burden, the U.S. is also not improving as quickly as other countries, which means the gap is growing. And this is from the Associated Press. Countries including Denmark, Britain, and Germany provide comprehensive benefits, including such services as mental health care. They charge low copays. Those countries are the closest to Medicare for All. A larger group, including Australia, France, Netherlands, Norway, Singapore, Sweden, Switzerland, and Taiwan, offer broad benefits, but there may be gaps, and cost sharing is higher. Australia charges $60 for specialist visits. The Netherlands has a $465 deductible. And let me just also add that 45,000 deaths occur every year because individuals lack health coverage. And this figure does not even include individuals that are underinsured. Consider the fact that individuals might go medically bankrupt because they are underinsured, may stop seeking treatment because they are underinsured, may be discouraged to go to the doctor at all because they are underinsured and don't want their family to accrue some sort of debt. So more individuals, as indicated by the comparison of the United States to OECD countries, people in the United States have a higher rate of premature death. So we've talked about wealth inequality, and we talked about how there is a way to pay for Medicare for All. Bernie Sanders has admitted that there needs to be a higher tax on the middle income. He has not put forward specific figures, but I do look forward to seeing those figures. And the lack of figures is not a reason to abandon Medicare for All, specifically when the wealth inequality gap is so large in this country. There is revenue to do this. But in the other corner, our golden boy, Pete Buttigieg, who's advocating for a public option, which I hope I've already described sufficiently, is a bad idea. He is still pushing against Medicare for All. He's still saying, how are you going to pay for it? How are you going to pay for it, Sanders? How are you going to pay for it? And Buttigieg says this as he takes the health industry's money so he can be competitive as a candidate while listening to lobbyists, those lobbyists that are advocating for a centrist proposal, which is what Buttigieg is endorsing. Buttigieg, who had formerly advocated for Medicare for All involving an abolition of private insurance, who nowadays, after taking that money, rearranging his position to something favorable to what lobbyists want, is saying, no, well, I was never against private insurance. I always wanted private insurance to continue alongside Medicare for All, which either means Pete Buttigieg never understood the damn bill that Sanders wrote, which says that Medicare for All would involve an abolition of private insurance. He either was too foolish not to understand that, which somebody who is running for president needs to know what exactly they are endorsing before they endorse it, especially when it's a centerpiece of Medicare for All, a centerpiece of that proposal. He's either too foolish or so opportunist that he went along with whatever was popular. And he just said, look, okay, it's popular, then I'm for it. So what is it? Are you just super foolish or super opportunistic? Or did you just see the light coincidentally in correlation with you taking corporate money. With you taking that money from the health industry, you saw the light and adapted a position more favorable to them. You saw the light. So, I don't know. I'm not on Pete Buttigieg's side on this. Sorry. We have extraordinary wealth inequality in this nation. We have more than enough to pay for this. And I think it's wise to take on a system where wealth is so consolidated, where those resources can be reallocated to individuals, and we can prevent those 45,000 people from dying every year. I think it's appropriate to endorse that kind of movement of resources to ensure those lives are saved. And I think it shows how deeply disgusting someone like Pete Buttigieg is for saying, no, let's not go with that. We can do that. We can take on the system. We can save those lives. But I'm getting this money, which is making me stay competitive. You know, this money from the health industry. Nah, I can't take it on. I can't take on the system. In fact, I'm going to try to stand in the way of people that are trying to take it on. So, whatever. I've explained Medicare-for-All. We can pay for it, but progressives do need to emphasize, I'm looking at you, Elizabeth Warren, that we do need to emphasize that taxes will be going up on the middle class, even if there is, as Warren pointed out, a net savings in cost. Hey guys, I hope you liked this video. Make sure, if you did, to click like down below and subscribe to this channel. And remember to click the bell. That way you'll get a notification whenever a new video is uploaded. Share this video with whoever you feel might find it valuable. And just remember, the more likes this video gets, the more views, and the more subscriptions, the more this channel can thrive and grow. Thank you.